open up, actually fell out, preventing them from entering the periodontal tissues and protecting the root from bacterial attack. And as an important part of the periodontium, it also helps hold the teeth in place, acting as a shock absorber for the hard tissues and reducing the pressure on the teeth and alveolar bone when you chew. Of course, all of the above functions come with one condition: your gums have to be healthy. Unfortunately, according to the 2017, the doctor's diagnosis wasn't just adding insult to injury. Fourth National Oral Health Epidemiological Survey Report. Just among residents in their 30s and 40s, the detection rate of bleeding gums was as high as 87% compared to the previous decade. That's an increase of 10 percentage points. So how do perfectly healthy gums end up getting sick? When dental plaque builds up on the tooth surface, gum inflammation can happen very quickly. It was more like a devastating blow. How quickly, you ask? 24 hours is all it takes. Around the second to fourth day of plaque accumulation, the cellular immune response becomes very noticeable. At this stage, the area of inflammatory infiltration makes up about 5% of the gingival connective tissue. But at this point, the gums still appear clinically healthy. This is also known as the initial lesion. After about 4 to 7 days of plaque buildup, your periodontitis is too severe. I recommend we pull all of them. The inflammatory infiltration accounts for about 15% of the gingival connective tissue's volume. At this stage of the lesion, signs of inflammation become clinically visible, and this is generally considered an early lesion. As plaque continues to accumulate, the inflammation gets worse, and we enter the stage of an established lesion or a chronic gingivitis. For a woman, during this stage of the disease, it's very common to observe the following problems. Your gums might bleed when you brush your teeth or bite into something hard, and you might also experience noticeable swelling and other discomfort. It can even be accompanied by severe unbearable pain. In addition, severe cases can involve periodontal pockets, bad breath, and gum recession. And there are two main reasons, who was only in her 30s, behind all of this. The first one is what we call dental plaque. The reason it causes cavities is that the cavity-causing bacteria within it metabolize sugar from food-producing acid that corrodes your teeth. The plaque that causes periodontal disease compared to the plaque that causes cavities has different primary bacteria, but besides that, it also sticks more easily to the gingival sulcus. That's the junction between your teeth and gums. This triggers an immune response from your body. This was undoubtedly a bolt from the blue, leading to inflammation that destroys the structure of your gum tissue. Other factors like tartar, food getting stuck, faulty dental work, crowded or misaligned teeth, and even mouth breathing can all encourage plaque to build up, causing or worsening gum inflammation. Then the gums no longer fit snugly against the tooth surface, forming periodontal pockets. Problems like bad breath will soon follow. The other key factor is something that's very easy, but her condition had progressed to this point, and she had no choice but to overlook in our daily lives mechanical damage to the gums. These two things are the main culprits behind gum damage and recession. So what is gum recession? It's when the edge of the gum recedes towards the root, leaving the tooth root exposed. When it comes to mechanical trauma, the most common cause is improper brushing, like using a toothbrush with bristles that are too hard, using toothpaste with abrasive particles that are too coarse. Follow the doctor's advice. Or brushing with a back-and-forth sawing motion, improper brushing technique, or brushing too hard, and so on. Additionally, some self-inflicted injuries can also cause gum recession. Things like bad habits such as picking at your gums with your fingernails or using toothpicks improperly. And gum recession in turn can lead to some pretty serious consequences, like bigger gaps between your teeth and exposed tooth roots. Once you have widespread gum recession, or it progresses to a severe stage of gum disease, not only will your gums not be able to recover, but you could face the same dilemma as Xiao Shui from the beginning of our story. Constant bleeding when you brush and even being forced to have all your teeth pulled out could become your reality. It's no exaggeration to say that once the damage is diagnosed, from 2017 to seeking professional treatment becomes extremely urgent, according to the textbook Periodontitis. For cases where the cause is clear and there's no damage to the deep periodontal tissues, a professional cleaning or scaling can completely remove plaque and tartar, eliminating the factors that cause plaque buildup and local gum irritation. In about a week, the gum inflammation can subside. Your gums can go back to looking and feeling completely normal. For patients with more severe gum inflammation, topical medications can also be used. For most patients, once the cause is removed, the inflammation goes away and the gums return to their normal shape. For the few whose gums don't return to normal after the inflammation is gone, surgery might be an option. A 36-year-old woman, 2019, Xiao Shui made over 20 trips to the hospital. The book also mentions that gingivitis is very likely to come back, so the most crucial thing is prevention. Besides consistently maintaining good oral hygiene, if you can, it's best to see a dentist regularly every 6 to 12 months. And also learn to use dental floss to clean the debris from the sides of your teeth. Because your teeth, in most cases, in about a week, the gum inflammation can subside. The color, shape, and texture of the gums can return to completely normal. For patients with more severe gum inflammation, that's right, you heard me correctly, over 20 trips in 2 years, topical medications can be used as a supplementary treatment. For most patients, after the cause is removed, the inflammation subsides, and the shape of the gums can return to normal. For the few cases where after the inflammation is gone, the gums still don't return to normal, surgery can be an option. The book also mentions that gingivitis is very likely to come back. So the most crucial thing is still prevention. Besides consistently maintaining good, she finally had all of her bad teeth removed. Oral hygiene, if you can. It's best to every 6 to 12 months see a dentist regularly, and also learn to use dental floss to clean the sides of your teeth of any debris, because your teeth. The adjacent sides are usually very difficult to clean by brushing. And of course, there's the most important part, brushing your teeth, and the gingival sulcus. That's right, when you brush your teeth, you have to brush the gingival sulcus. Cleaning this area is extremely important. During that time, she cried every single day. But it's often overlooked. Most of you guys probably just grab your toothbrush and scrub your teeth like crazy, having no idea that you also need to brush the space between your gums and teeth. The well-known Bass brushing method is an effective way to remove plaque from within the gingival sulcus and on the tooth surface. Plaque. Besides making sure to brush twice a day for 2 minutes each time, there's another very important point that you might not be aware of. The amount of pressure you use when brushing is also key. If you don't control the pressure well when brushing, she was afraid to speak, afraid to look in the mirror, afraid to leave the house. It's very easy to damage your gums because your gums are very delicate. An article from the West China School of Stomatology titled, "Are Wedge-Shaped Defects at the Tooth Neck Caused by Brushing?" also mentioned that brushing too hard over a long period of time often accelerates gum recession and the formation of wedge-shaped defects. Too much pressure hurts the gums, but too little doesn't clean properly. So what's a person to do? Not only was her appearance ruined, but even eating became a problem. Hey, actually, regarding this issue, the academic world has already looked into it. A review article on the effects of toothbrushing found that keeping the brushing force between 2 to 3 newtons may be gentler on the tissue while still effectively removing dental plaque. In other words, precisely controlling the brushing force within the 200 to 300 gram range. But this tragedy didn't just happen overnight. Is the key to balancing cleaning with gum protection. Another study examined 103 adults who had not received any brushing instructions and used manual toothbrushes, looking at their brushing habits and the resulting effects. The results showed that only 25% of participants met all the criteria, which were brushing at least twice a day for 2 minutes each time, with a force of less than 3 newtons. The warning signs had appeared as early as when she was 14, and using a circular or vertical sweeping motion. The paper also suggests that brushing force seems to be linked with gum recession. This is because subjects with severe recession, mild recession, and no recession, respectively showed 3.8 plus or minus 0.5, 2.4 plus or minus 0.4, and 2.1 plus or minus 0.3 newtons of average brushing force. Subjects with wedge-shaped defects back then had an average brushing force that was significantly higher than subjects without cervical wear. Now, everyone gets the theory, but putting it into practice is tough. For the average person to consistently maintain this range of force every time they brush, it's a nearly impossible task. This is where you might start thinking, can an electric toothbrush solve this force control problem? In reality, many electric toothbrushes on the market that claim her gums would bleed every time she brushed her teeth, but it was always ignored. To have pressure sensors are pretty mediocre. They're either too slow to react, and by the time you get the alert, the force has already been applied to your teeth, or the monitoring isn't accurate enough. The margin of error can be as high as 1 or 200 grams, which can end up damaging your gums even more. But this Two-Sonic electric toothbrush I've been using recently offers a genuinely effective solution to this core problem. Never imagined that at her age until it was too late to fix. It strikes a great balance between protecting your gums and cleaning power. It not only solves the problem of force control with manual brushing, but also tackles the core issue of not being able to clean properly when the force is too light and damaging your gums when it's too strong. Its pressure sensor system can also monitor your brushing force in real time as you brush, the moment it detects the pressure has exceeded. And the scariest part is Xiaoshui's case is not an isolated one. The preset safety limit, it alerts you immediately. Just how immediate is that? 0.16 seconds. And don't underestimate a 0.16 second response time. because that ensures the action is stopped before any damage can occur. Model C. Compared to the slow-reacting solutions in the industry, this reaction speed is a whole generation ahead. Besides, being fast is useless if it's not accurate. Most electric toothbrushes on the market today either have no pressure feedback at all, or their pressure feedback has a massive margin of error. We're talking up to 200 grams. This means that by the time the damage has already been done, it either warns you too late or not at all. So the core goal of preventing gum damage is basically impossible to achieve. But the life and sweep and vibrate. Electric toothbrush air can control the force deviation to within plus or minus 30 grams at a young age because of periodontal problems, providing truly precise protection. Behind this super-sensitive system is a solid and reliable structural design. When the brush head feels pressure, that force is transferred using the principle of leverage to an internal sensor where it's converted into a clear electrical signal. Lifen has meticulously upgraded this entire structure so that the signal loses less power, end up losing half of their teeth, and has less deviation during transmission, ensuring it stays stable and reliable even after long-term use. In contrast, many other toothbrushes on the market can start to misread the pressure or lag after a while. On top of this clever structure, the Lifen Air has also put a ton of work into the part that actually goes in your mouth to address both gum protection and cleaning. They've completely upgraded the brush head. It uses a baby pacifier-grade soft rubber brush head, and they still don't even know what periodontal disease is, with bristles strategically planted in different zones. The outer bristles that touch your gums are incredibly soft, while the bristles in the middle and on the inside are more focused on cleaning power. So the outside gently protects your gums, the middle gets deep between your teeth, and the inside gives a final deep clean. They've even added special fading bristles that remind you when it's time to change the brush head. And on top of all that, they also offer a variety of brush head options for most people. So there's something for you whether you have sensitive gums or wide gaps between your teeth, or if you have coffee or smoke stains, or if you're just trying to get a quick clean on a busy morning, you can find a brush head that's truly right for you. A 90-day clinical study from the Lanzhou University Dental Hospital showed that after using the Lifen electric toothbrush for 90 days, users' gum. When you talk about oral health problems, bleeding index decreased by 56.6%, and gum inflammation was reduced by 22%. Its plaque removal ability tested by SGS was also shown to be far superior to similar products. I have to say this is truly an electric toothbrush worth recommending. Not only is it powerful at cleaning, but it also genuinely improves the condition of your gums. So what happens if you just let these problems go unchecked? They basically think of issues with the teeth. Back in 1976, Page and Schroeder, based on clinical and histological observations, divided the progression from healthy gums to periodontitis into 4 stages: the initial lesion, the early lesion, the established lesion, and the advanced lesion. There are no clear boundaries between them. It's a continuous process. The first 3 stages we just described, initial, early, and established lesions, themselves like cavities, are basically equivalent to what's clinically known as gingivitis. If by this stage, there's still no effective intervention or active prevention, then the lesion will continue to expand and worsen, reaching the advanced lesion stage. Clinically, this is understood as periodontitis. Therefore, periodontitis is often a serious condition. Its specific manifestation is that the gum loses its attachment. She would lose all her teeth and become tooth decay and that kind of thing to the tooth root and slowly peels away, thus forming a periodontal pocket. Once a periodontal pocket forms, it becomes even easier for food debris and bacteria to accumulate. They can then travel straight down the pocket, invading deeper areas and next the alveolar bone. As the bone resorbs, the gums recede with it. At the same time, the collagen fibers in the gum's connective tissue are destroyed more severely. If not that they assume it's just some kind of inflammation, and as for accompanied by widespread inflammation and immunopathological damage. Gaps between teeth, exposed tooth roots, and other problems soon follow, as the alveolar bone resorbs down the root until only half or even just a third of it is supported. The tooth's foundation eventually becomes unstable, causing it to loosen and fall out. It's no exaggeration to say, if you want a healthy set of teeth to enjoy all kinds of food, other important oral health problems, then proper daily oral hygiene and maintenance, and getting timely treatment when problems arise, are things you really need to take seriously. Otherwise, once it progresses to the stage of periodontal disease, it becomes both expensive and incredibly painful. Currently, periodontitis has become one of China's most common and prominent oral health problems, according to the 4th National Oral Health Survey. In China, among adults over 30, like gum disease or periodontal disease, about 62% suffer from some form of periodontitis. But many people still think that oral health problems are no big deal. If a tooth falls out, you can just get a new one, right? However, that's not the case at all. The health of your mouth, especially your periodontal tissues, has an impact on your overall systemic health that goes far beyond what most people realize. In recent years, numerous studies have shown that their understanding is extremely limited, closely linked to systemic diseases. The possible mechanisms include those shown on screen. Through the possible mechanisms mentioned, periodontitis has a kind of two-way relationship with many systemic diseases, according to periodontology textbooks, as well as the Chinese Journal of Stomatology, and other authoritative international and domestic journals. It may be linked to at least 43 systemic diseases, including cardiovascular and cerebrovascular diseases, diabetes. But what might surprise you is this: chronic kidney disease, respiratory diseases, and Alzheimer's disease, like rheumatoid arthritis and cancer. In addition, blood disorders, rare diseases, and even pregnancy in women can all have unique effects on your gum tissue. Just take a look at these screenshots. All of this evidence shows that periodontal health is no small matter. It's not just about your gums. It's closely linked to your entire body's health. This thin little cuff. So for everyone watching, you must take your oral hygiene seriously. And speaking of which, I have to mention our fantastic helper for brushing and gum care, the Lifen Sonic Electric Toothbrush. It doesn't just clean powerfully and look great, it also has precise pressure-sensing technology to protect your gums right along with you. So what are you waiting for? Go ahead and give it a try. Alright, that's all for this video. I'm Xiao Kong. Follow us. We call our gums. And stay tuned for more great content. Isn't just about your mouth, it's connected to the health of your entire body. A young old lady. So today let's talk about the mouth's underappreciated yet fragile gatekeeper, the gums. In reality, your gums are just one part of the periodontal tissue besides the gums. As you can see in this diagram, the periodontal tissue also includes the periodontal ligament, the cementum, and the alveolar bone. The job of this system, or rather, the job of the periodontal tissue, is to anchor your teeth. In 2017, firmly into your jawbone. It withstands the force of chewing while also creating a tight seal between the oral mucosa and the hard tissues of the tooth, preventing food debris and bacteria from getting in. But today we're going to focus mainly on the gums, a part of our mouth that's super easy to ignore. And ironically, ignoring this one little area can lead to a whole host of serious periodontal problems down the road. The gums, or gingiva, are the special mucous membrane. Shoshuk noticed that a few of her teeth were starting to feel loose, that covers the jawbone and surrounds the neck of each tooth. They're made of an epithelium and the connective tissue underneath, and consist of three parts: the free gingiva, the attached gingiva, and the interdental papilla. The free gingiva is about 1 millimeter wide and forms a little collar around the neck of the tooth. When healthy, it's pink thin and fits snugly against the tooth's surface. The tiny space between the free gingiva and the tooth is called the gingival sulcus. You can use a probe to gently separate the free gingiva from the tooth's surface. So she used her own hand. Now this spot is super important, so you'll want to pay attention. In a dental clinic, they use a special marked tool called a periodontal probe to measure the depth of this sulcus. This is called the periodontal probing depth. It's a key indicator of your gum health. For healthy gums, the probing depth shouldn't be more than 3 millimeters. But what about a periodontal pocket? Ever heard of that? That's just a gingival sulcus that has become pathologically deep. The attached gingiva connects to the free gingiva to gently wiggle one, and to her surprise, the tooth, and extends down to meet the alveolar mucosa at the bottom, has fewer blood vessels and is pink in color, and it's highly resistant to local irritation. The gingival papilla refers to the gum that rises up between two teeth. The main function of the gums is relatively simple. As a soft tissue that surrounds the root of the tooth, it's like a tight cuff, providing a perfect seal for the tooth root. This way it can seal out bacteria,